Hello, I am Khushbu Gandhi and I'm going to present an essay for the critical thinking and nursing theory in practice. Practice change using critical thinking. Critical thinking skills have been identified as a necessary component of nursing education, and during these 8 weeks, we all have learned about that. Before learning about that skill, I was not too aware about it, but now I have a proper understanding of key aspects of critical thinking and how it can apply in the clinical areas. Apart from that, I learned about a variety of learning styles and how it is influencing my critical thinking. After learning this, I can understand my learning style, which isn't a personal. Moreover, I understand that critical thinking impacts patients' quality of care and patient safety and use for quality improvements. Critical thinking is the ability to think in a systematic and logical manner, solve problems, make decisions, and establishing priorities in clinical settings. For example, once I was assigned with 4 patients in the medical ward. Among them, one patient was complaining about less urination. At the same time, the doctor came and asked to start the noradrenaline infusion to the patient with low blood pressure. One patient was demanding to change his clothes. So that time I used my critical thinking skill and first prioritize my work. I immediately start infusion to the patient as it was an emergency and then do other work accordingly. In this example, I have used my critical thinking as well as clinical reasoning and clinical judgment. In critical thinking, I also learn about the components in which some are habits of mind and some are cognitive skills. Among them, I want to cite an example for intuition. Intuition means inner feeling guessing. When I was in labor room, a mother who was going to deliver a baby kicked me. I got intuition and I immediately told to the doctor and it was not a normal kick. I suggested that she may develop an epileptic condition very soon. Within 5 minutes, she got convulsed. It happens to me because I have experienced that type of condition 2 times before. So it was my critical thinking, and it comes from the experience also. After learning critical thinking, I come across my strength and some areas in which I have to develop and strengthen them. I observe that I am very flexible and creative, confident and open-minded. I also observe and reflect on the things in my clinical practice. I know some skills like predictions, logical reasoning, and analyzing the situation after learning. Apart from that, I learn about the advocacy and its strengths and barriers in a clinical area. It increases patient outcomes and increase the job satisfaction. The CNO provides guidelines for the advocacy for the well-being of the patient and family needs and wishes. I can learn about the assessing of needs for patient advocacy, then identify the goals of patient advocacy. Then I can plan and implement it, and lastly evaluate the outcomes of the patient advocacy. So during these 8 weeks, I gained lots of things about critical thinking and how it works in the clinical area.